Hello everyone, I'm Catherine. Welcome to the Inspired Vitality Show. I'm publishing a special bonus video today because someone reached out to me on social media asking that I do a video about a rare cancer. Now, before doing my research, I had never heard of this cancer myself, honestly. The common name or abbreviation is PMP, and I'm going to attempt to say the full name, but please forgive me if I don't get it right. Even if I practice over and over, I may not get it right. So I'm going to go forward with imperfection anyway. Bear with me, please. Join me in learning about PMP, what makes it different, and where you can go to find support if you have been impacted by PMP. Sue-doh-mix-oh-muh, peritonei, or PMP, is so rare that it is thought to affect just 1 or 2 people per million each year, and it is grouped with appendix cancer. Because of the fact that PMP cancer is so rare, it's really important to be educated about it. In doing my research, some people are misdiagnosed, and it can be difficult to find a doctor who has the background to treat it. In most cases, PMP starts in the appendix. More rarely, it can start in other parts of the body, such as the bowel, an ovary, or the bladder. A tumor develops in the appendix from a polyp, and at this early stage, the tumor is rarely discovered as it doesn't cause any symptoms. Now, if it's left untreated, the tumor grows and eventually bursts through the wall of the appendix into the abdominal cavity, where more tumors then develop. These tumors secrete a jelly-like substance called mucin, which accumulates in your abdominal cavity. It is this buildup of mucin that causes symptoms. The abdomen swells, leading to the characteristic jelly belly, and vital organs are compressed. Unlike other types of cancer, PMP seldom spreads through the bloodstream or the lymphatic system. This means it stays contained within the abdomen, but the mucin spreads it along the inner surfaces. Some patients don't show any symptoms for several years, and the symptoms of PMP vary widely among patients. As the disease progresses, many patients can report abdominal swelling or the increase in abdominal girth, changes in bowel habit, loss of appetite, pelvic or abdominal pain, general fatigue, and bowel irritation. These symptoms can also be caused by lots of medical conditions other than PMP, adding to the difficulties of the diagnosing. So, thinking about treatment, you might be thinking that the treatment would be to simply remove the appendix. If a low-grade tumor is found in the appendix and it hasn't ruptured, then the treatment is removing the appendix. However, as I said, the symptoms typically don't develop until the tumor has broken through the wall of the appendix and released the mucinous cells into the abdomen cavity. Just having the appendix out at that stage wouldn't remove those cells, and tumors would continue to develop. The mucin would continue to be produced, and PMP would then develop. Treatment for mucinous tumors that have spread into the abdomen, either low grade or high grade, is called debulking surgery to remove the mucin and tumor implants in the abdominal cavity. I'm not even going to try to say the formal name of the debulking surgery. But what it does is it removes the tumors that have seeded around the abdominal cavity, and it is a very long operation, usually 10 to 14 hours. This is followed by a type of liquid chemotherapy that is poured into the abdomen, swished around, and then drained off. It is done in the operating room before the patient is closed up, and possibly again soon after surgery using a port or tube. This type of chemotherapy procedure is called the Sugar-Baker technique, after Dr. Paul Sugar-Baker. Of course, the purpose is to kill off any remaining cancer cells after the operation to prevent them from growing new tumors. I want to thank the organization Pseudomyxoma survivor for providing great resources and information. They provide also emotional support and practical advice to those impacted by PMP and also appendix cancer. I'm going to put a link to their website in my video description. In reading some of the survivor stories on the website, I learned that for PMP patients, because it is such a rare cancer, it is hard to find information about it and hard to find qualified doctors for treatment. As with all cancers, the physical and emotional toll on the patient can be ongoing for some. Thank you for joining me in diving into a rare and important cancer. If you haven't already, please do subscribe to my channel. See you in the next video.